All right, we're going to talk a little bit about thumb extensors. All right, go under the radar. In particular, we're going to be looking at three muscles and obviously the relationship of their tendons as well. So we've got abductor and we've got extensor pollis and pollis brevis. We've also got another abductor muscle down through here as well. So I'll get Seb just to go and bring. There you go. So there's one there, and then on the other side here, you can see the other tendon there. Okay, so those tendons come up here, and if we represent them bestly, probably through here, as we can see, there's the muscle belly coming down. They sort of form that one tendon, and then we've got the other one that comes down through here as well. Okay, so we've got abductor and extensor, pollis longus and brevis. All right, so very, very, very important muscles when it comes to thumb function. Now, in terms of treating this muscle, because we've got a lot of our forearm flexors coming down here, and most of them are coming out on that lateral side, if we come out to the medial side, this is where we're going to find these adductor pollis muscles, okay? And as massage therapists, if we're using a lot of our thumbs, then this is going to be a bit of a key area for us too. Usually you develop a fairly good musculature through those muscles as well. So it is really important that we are treating those muscles. So for me, a lot of the treatment that I do here is basically coming right up and then over the radial bone here, and you'll find that you can pick up the trigger points just about there. So they're small muscles, they don't need a huge amount of pressure. So, and what I tend to do is I can use, because they're such small muscles, we can actually use a little bit of our thumbs for this. And what I tend to do is I get my clients to go in from flexion and then an extension, okay, like doing that movement there, okay. So I just want you to slowly do a little bit of that. And so what I do is I just drag the tissue back towards me. Okay, so pick it up, backwards and forwards, and you can find nice little trigger points in through that area there. And back up, all the way through. Yep, just small movements, Seb, just, yep, back and forwards. And so you're dragging the tissue back towards you along like so, okay? You can see the tendon coming down here. Okay, if I turn it over a little bit further, then I'm going to pick up the next one. Okay, so same again, up and down and just backwards and forwards. Okay, so they really do come under the radar, these muscles. Really highly important for anyone who's actually using, well, anyone who suffers from Weeder's thumb or pulling and all that sort of stuff. Obviously, massage therapists, anyone who's using their digits in an overuse situation, this is going to be a big part of it. So backwards and forwards. Okay, pick up the other one through here. And then if we come out here a little bit further, and then we've got another little muscle called the extensor indicus, which comes all the way down here and interdigitates with that index finger as well. So to find that, you'll just get, you move your finger through there, Seb. So you come out in between the radial and ulnar bone, back over into that sort of radial bone. And again, just keep moving it up and down. And you should feel that muscle moving underneath. It's only a really small slither of a muscle, but it's highly, highly important, especially once again when we're talking about finger dysfunction and movement. So in and out. That's it. Just keep moving up and down. Once again, it's a really small muscle. We don't need a huge amount of pressure on it. It's just backwards and forwards, like so. Okay. So it obviously comes all the way down here and attaches on there. All right, that's abductor and extensor pollicis and the extensor indicus. Okay, so we're on top of the radial bone here. Okay, so this is where the extensor and Abductor Pollicis Longus is going to be. So once again, we're going to be moving the thumb just into extension, back out. So we're going to roll backwards as we work through that tissue, like so. And again. Okay, drop over the top of the radial bone. Okay. And you should be able to feel this muscle moving underneath. Okay. Sink down, so it's going to be more out, coming out to that radial, that ulnar bone, because it comes across diagonally. And so you'll find the attachment is deep into that. And once again, the referral will go all the way down to that index finger. Okay. Okay, extensor indicus. And then obviously we've got that the adductor pollis muscles through there. So push up against me, push up against there, and then you can feel all that musculature there going all the way through here. Okay, so it's all through that area. Okay.